Have you or a loved one recently undergone radiation therapy, and now you are noticing some unexpected shifts in your digestion? It is completely normal to feel a bit confused or concerned when your body starts behaving differently. Bowel habits often change after radiation treatment because the radiation, while targeting cancer cells, can also affect healthy cells in your digestive tract, leading to temporary or sometimes long-term alterations in how your bowels function. These changes are a common side effect, and understanding them is a key part of managing your recovery. The core reason for these changes lies in how radiation interacts with the delicate tissues lining your bowel. Radiation therapy uses high-energy rays to destroy cancer cells, but these rays can also cause inflammation and damage to the rapidly dividing cells of the intestinal lining, which are similar to cancer cells in their growth rate. This immediate effect is known as acute radiation proctitis or enteritis, causing symptoms like diarrhea, urgency, and discomfort. Over time, sometimes months or even years later, this initial inflammation can lead to more permanent changes. The healing process can result in scarring, called fibrosis, which makes the bowel wall thicker and less flexible. Radiation can also affect the tiny nerves that control bowel movements, altering how quickly food moves through your system and how well your body absorbs water. These combined effects explain why you might experience more frequent bowel movements, increased urgency, or even constipation and bloating, depending on which part of the bowel was treated and the extent of the impact. To help manage these changes, start by paying close attention to your diet. Many people find a low-fiber or low-residue diet helpful during periods of acute inflammation, reducing the bulk of stool and giving your bowel a chance to heal. Staying well hydrated by drinking plenty of water throughout the day is also crucial, especially if you are experiencing diarrhea. Keeping a journal of your food intake and bowel movements can help you identify specific triggers. Remember to communicate openly with your healthcare team about any changes or discomfort you experience, as they can offer personalized advice and prescribe medications to alleviate symptoms. Understanding terms like radiation proctitis and fibrosis helps you know what is happening inside your body. Acute radiation proctitis refers to the immediate inflammation and irritation of the rectum that can occur during or soon after treatment. Chronic radiation proctitis, which sometimes involves fibrosis, can develop months or even years later and may cause persistent symptoms due to scarring and damage to blood vessels. Recognizing these potential long-term effects allows you to be proactive in your follow-up care and seek appropriate interventions. Ultimately, recognizing that altered bowel habits are a common and expected outcome of radiation treatment empowers you to take an active role in your recovery. By understanding the underlying reasons and adopting practical strategies, you can effectively manage these side effects and improve your quality of life after therapy. Open communication with your medical team ensures you receive the best possible support and care for your individual needs.